This tutorial will show you standard operations and options. This app is called the House DNA Robot, or House DR for short, version 7.26. This tutorial will also show you the general anatomy of the House DNA Robot. There are essentially two screens, the main appointment page and the routing template. The routing template page will be examined in just a moment. Just press on the patient's name here and MAP will take you to the routing template page. This is essentially the part that the clinical staff would be using. The lower part is essentially the part that the administrative or business staff would be using to schedule appointments. The main appointment page, or MAP screen, has an upper part and a lower part. The upper part is the appointment book. The lower part has patient scheduling related fields to schedule an appointment and to list patient's information. Just touch on the Make Appointment or Schedule Appointment button to open the scheduler part. The lower part of the screen will expand and patient scheduler fields and selections are opened. To close or collapse the lower part, just click here on the red X. Again, this part is the part that the clinical staff would be essentially using throughout the day, whereas the administrative and business staff will be using this part down here. Patient names may be entered by using the Patient Files button. Alternatively, patient names and information can be ported from another external program and filed to this app. Now, let's go to the routing template page. The routing template page keeps track of the patient's last 4 diagnoses listed here on file. This page is like a worksheet. To create, change, and file another diagnosis, we would enter that diagnosis in this field here. There are 2 ways to enter CPT and to enter ICD diagnosis information. There is a button and a predictive text box. The predictive text allows a simple way to search for CPT and ICD. Enter the first 2 letters of a number or in-house code into the CPT box. You can see that there are various ways to enter in CPT, in-house code letters, or directly by using the CPT code number. The ICD button accesses the ICD diagnosis codes. In the same way, you could enter in letters into the predictive box. And now we correspond those to diagnosis codes. This button is used to reschedule the appointment for the return to office. This button here is to review what we've just done. Now let's send this to post. The data has now populated the external program. When we generate another routing template, we will see that the fields are now cleared. This concludes the basic review and general anatomy.